There are hundreds of thousands of patients in the United States alone who receive vascular grafts of some type each year, either for the treatment of peripheral arterial disease, patients who are on dialysis who have arterial venous access grafts or dialysis fistulas, patients with coronary artery disease, and so many other indications for vascular grafts. Unfortunately, despite our best efforts, these vascular grafts oftentimes fail.
Our recent research has shown that there's multiple subtypes of cells within the arterial wall that is responding differently to the prosthetic bypass graft. And we believe that these signals are causing the bypass graft to fail.
What Patric brought to this during his research time is the development of gels that would carry silencing RNA. That's a substance that will silence a specific gene that we can apply to the material at the junction of that material with the artery. So we're right at that point. And he's stepping into this at that key point in our history. It's very exciting.
Patric's research has the potential to have an enormous impact on patients. With the graft failure from intimal hyperplasia, if he can learn how to tame that down, then we won't have to redo bypasses. The techniques that he's using can be applied to interventional procedures as well, like angioplasty and stenting, to try to keep arteries open longer. So I think he could decrease the need for reinterventions, keep arteries, bypasses, stents open longer, cut down the cost of medical care, and most importantly, save legs and improve the time that people have with a healed leg so that they can function normally in life. And I think with his intelligence, his drive, the way he interacts with patients, I think he's someone that can really move this whole field forward.
There are very few foundations in the world like Vascular Cures that's uniquely focused on vascular health innovation, and we're very fortunate as vascular surgeons to have support of such a fantastic organization to help advance our surgical specialty, support new innovative therapies, and ultimately help provide better and more durable options to our patients and their families. The Wylie Scholar program is an incredible opportunity for early career vascular surgeon scientists to not only obtain funding for promising research innovations, but also to cultivate collaborations with other leading scientists all around the world. The Wylie Award will absolutely have a huge impact on my career and will lay a foundation for me to become a successful researcher. Specifically, this award will help expedite the clinical translation of our gene therapy platform to the real world, and in turn help all those patients who are waiting and suffering from the current limitations of high-risk prosthetic bypass grafts.
And I can say I knew Jack Wylie, and I think Jack would be very pleased with Patric as someone who is likely to make lifelong contributions to the advancement of vascular surgery.